Alright. By name, I'm Dr. Nwachukwu. I'm the owner of this facility, the BC Hospital, with my brother. I'm the surgeon that does all the surgeries here, the ones within my area. So I'm the person that operated on the baby that you guys want to know more about. MBBS, Bachelor in Medicine, Bachelor in Surgery from the University of Nigeria, 2017. The baby you saw, we have what we call congenital abnormality. And when we come to this congenital abnormality, about 50% of the causes are not known. So the other 50%, there are many things that can cause or lead to this such kind of abnormality. You can have a chromosomal disorder, you can have a gene defect, environmental factors also plays a role, and also micronutrient deficiency also lead to that. There are ways you can prevent it for the ones in which you can do something about. Like for the one I talk about micronutrient deficiency, we can prevent that. And by so doing, that's why we encourage mothers, pregnant women to be coming for antenatal clinics. When they visit antenatal clinics, normally give them some drugs, which we call routine drugs. And those drugs help in doing many things. Number one, in prevention of such congenital anomaly. Then number two, the drugs also help in what we call a production of blood, because during delivery, whether by vagina or through abdominal delivery, a pregnant woman definitely releases blood. So those routine drugs that we give them helps in prevention of this congenital anomaly for the one that has to do with micronutrient deficiency. As I said earlier on, there are some that have a link to gene disorder, a gene defect. Those ones we can do little or not to that. But those ones that have area of micronutrient deficiency and others, we can work on it. The baby you saw has what we call anencephaly. There's no cover of the cranial vault. And that baby you saw already have what we call IUFD, intrauterine fetal death. So, for that particular baby that is on the picture already, you cannot do anything to prevent it. It's a normal human being like us, but assume that the mother attended antenatal clinic and did ultrasound, you could have been detected earlier on before then. Because when I came in contact with the mother was already level and said that the baby is no longer kicking and they have to induce her for the baby to come out. So when we did ultrasound, found out that the baby is no longer alive. I would like to operate on this woman to save her life, not the life of the baby again. It is not something that is very common. Like for this year, I've had 2 cases of that. Number one is a baby with hydrocephalus, in which the mother was in labor for more than 2 days trying to deliver this baby. And when the labor wasn't progressing, they visited our facility. They sectioned the woman, brought out the baby, and the baby has what we call hydrocephalus. So, and the woman already has ruptured womb. So we try to repair the issues. So it's not something that occurs very often. The second is this one, the baby that has anencephaly. So it's not a common occurrence, it's very rare. Yes, definitely. The surgeries we do these days, especially the CS, we make sure that the patient is aware. We use spinal anesthesis. So by so doing, the patient is aware of everything that's happening in the theater. So when the baby comes out, probably they respect the baby. So but when we come into such situation where the baby is no longer alive, we'll try to tell the mother to calm down first, that her life is the main important thing, while we'll now end up with the surgery. Then we'll come out from the surgery room, and she's in the recovery room, she'll be asking questions about the baby. So sometimes we'll try to tell the mother that the baby is in the suspension room so that the mother will recover before telling her the truth. But the father of the baby, you see the baby, immediately the baby is out. So you see the condition of his child. The baby in question As I said earlier on, when I open up, the baby already have what's called IUFD. That's intrauterine fetal death. The baby is no longer alive. So, and this was already macerated. So, we're trying to clean up the woman, do the needful inside the theater, and they handed over the baby to the father, who went straight to the village to bury the baby. It is actually a baby, not a ghost. Because some people after the surgery was saying that the woman did not carry a baby, that what the woman carried was a ghost or those things. No. It's actually a baby that had a congenital anomaly and a deformity, which can happen to any of us. So definitely, it's not a good news and it's not a good sight to behold. When the mother saw the child, the first thing she said that this cannot be my child. Nobody prays to have such. So the father too was also surprised. But this is a situation that we are seeing that the surgery is still ongoing and this is what we brought out from the womb. All we needed to do is just to cancel them and tell them that the one that will come next will be better than what we have now. Yes, the things we do, number one, we try to cancel the woman that her life is more important than any other thing. In which that once she's alive, she can give birth to as many children as she wants by God's grace. So once the woman recovers or the woman is still undergoing the recovery phase, we also try to explain to this woman that everything that happened have medical explanation, because some of them will go back to the village and start looking for who they had problem with or who they are not in good terms with to link it up to the cause of the child they gave birth to. So we also cancel this woman that this will have medical explanation, and if the medical approach is being taken, that the next baby probably will not have this kind of outcome. So when you encourage the woman and assures the woman that once she takes in, let her start her antenatal clinic and she will be properly monitored, this kind of baby will not be the outcome, because the woman in question never did ultrasound for once. And ideally, a pregnant woman should do ultrasound at least 3 times. The first one is after you notice that you're pregnant, you try to check where the baby is, and also the GL of the baby. The second is towards the middle of the pregnancy, you try to check how is the baby growing. The last scan is towards delivery. You now measure the position of the placenta and how big this baby is. But in this our area, we find out that most women doesn't go for antenatal. And whenever you suggest to them to go for antenatal clinic, they will tell you it's not necessary. But few that try to visit to go for ultrasound will normally detect some of all these things on time. And if any detection is being done, there are also medical approach which we can use to follow up, either by referring to a health center or by knowing if it's better to terminate the pregnancy at that point instead of coming up with this kind of outcome. Yes, depending on the type of congenital anomaly that you have, the chances varies. Like for the one I told you about, we deliver a baby that have hydrocephalus, the chance of surviving is there. The baby survived. When we deliver the baby, the next day we refer to the antibiotics when the baby was managed. I saw the baby 2 days ago. The baby is doing well. So depending on that particular type of congenital anomaly, there's one that can have it will affect the skeletal muscular system. Like for example, the one we call syndactyly is also a congenital anomaly. You can easily manage that one. There are ones that will happen at the central nervous system, like the anencephaly is not usually funny. Myelin cell also happen at the central nervous system, is also not funny but can be managed. Do you understand what I'm talking about? We have different types of congenital anomaly depending on the system that's affected. There are ones that will affect the urinary system, where it's called like hyposphilia, like ambiguous genitalia, like undescended testes. We manage them very well. So depending on the particular system that is affected, determines the prognosis of what you're having, the chance of survival, and others. Congenital anomaly, by way of definition, we can say it's either a structural or functional anomaly that occurs during intrauterine life. That's when the baby is still inside the womb. So if the anomaly is structural, most times organs have been spared. Do you understand what I'm talking about? But if the anomaly is functional, most times some organs are being also affected. Something like a baby that has hypospadias, we don't normally go to the organ involvement. We just structural defect. But a baby that has something like myelocell or encephalocell, sometimes some organs might be involved. Even a baby that have Down syndrome is also a congenital anomaly, the one that affects the chromosomes. Some organs are also involved. So there are some anomalies that will spare the organ, while there are some anomalies that will affect the organ. So depending on the system of the body, there will have the anomaly. The best way to calm them down is by giving them results. Like I have more than 3 patients who have had this kind of congenital anomaly before, and the next pregnancy, the baby is very okay. So when you cite some example, and some of them reside in this environment, when you cite some example for them, and they investigate and find out that it's true, they have the assurance that their own case will also turn around, that their next baby will be okay. But nevertheless, you must do a proper follow-up. You work on the patient's psychology. You keep reassuring the patient that this one is this way doesn't mean that the second one will be that way. So just proper follow-up, and also by then seeing that someone who has been in this shoe, in this position they are, will be asking of this kind of baby, and let her have a baby that's normal. They also believe their own case will be the same. So most times, once you follow them up properly, you see them, they come out from that emotional trauma, and they live their normal life as well. Okay. There are some medical conditions that you're going to see. You know, like we say abortion and miscarriage, most people misunderstand the terms, but actually medical terms are the same. There's a condition you're going to see, like there's a woman that operated on perhaps the last 3 months, and she took him this month. She came to me and told me that I'm pregnant again after 3 months. Then when you watch the clinical history of this woman carrying this pregnancy is a risk to the mother. Do you understand what I'm talking about? So in that kind of case, it's better you end the pregnancy. So there are some anomaly, a congenital anomaly that a pregnant woman will carry. Her own life too might be at risk. Like the one I told you about, the one that had a hydrocephalus and that was attending antenatal at a traditional birth attendant place. Before they rushed the woman here, the woman has been in labor for 2 days plus. When they rushed this woman here, this one really had what they call ruptured uterus, in which her life was at risk. It took us nothing less than 4 hours to repair the womb and to save the woman's life. But a woman that has a baby that has congenital anomaly of hydrocephalus, we don't know about her body baby. The baby lives very well. But there's some congenital anomaly you might get, and you say that this baby will not develop to time. I don't understand what I'm talking about. So the best you need to do is to avert this kind of thing from occurring. Like this woman that has this baby that has anencephaly. If this woman was told on time that this will be the outcome of this, believe me, should not allow this pregnancy to exceed more than 1 month. Do you understand what I'm talking about? And so when you see such thing, you cancel the woman and tell the woman this is what it is. And most times when you encounter such cases, we refer to high institutions, something like UNTH or Parkland, where they will follow up from other doctors who are higher. So there are some anomalies you see, you keep up with the pregnancy. There are some anomalies you see, you cancel the woman that this might be the outcome. And also, some of the drugs they ingest during the course of pregnancy also affect them. You see a woman that is pregnant, the woman will go along the roadside chemist to miss drug for herself. But she's treating malaria, she's treating typhoid. Without knowing that a pregnant woman is not allowed to take every medication, because we normally consider the baby who cannot talk and know the drug that the baby can tolerate. But those roadside chemist people doesn't know about a pregnant woman should take this drug, or a pregnant woman should not take this drug. So sometimes they also be the cause of their own problem. So, but it's not every congenital anomaly we talk about ending pregnancy. In fact, most of them, we don't talk about say end the pregnancy. Only the one that see that might endanger the life of the mother. That's when I talk about aborting it. For me, someone like me, I've been operating for more than 5 years, so it's not the first time I'm seeing it, it's not the second time. I don't normally operate with emotions. I was not happy about the outcome of the surgery, but I was guilty. So, but other people around me, the first time she said we are so surprised when they came out. And that's why I didn't know who I put in the picture before the thing now went viral. So, it's a rare thing to see. But me, I wasn't affected. I felt sorry for the woman for the outcome, but I wasn't going to change my mood at all. No, it's not fake stars. Oh, I really appreciate everybody working at Post Connect for coming to know more about the outcome of this video. I'm so glad at least the people out there will know the actual cause of this. There's no spiritual case, but has a medical explanation. And also, many of them will not know that there are some necessary things they can do to avert this kind of thing from occurring. And also learn that the best place to access best health quality care is in a hospital, not at home, not at a chemist. So I'm glad that this interview is being organized, and I really say big thanks to everybody working at Post Connect. I'm grateful.